Guardant Health هي شركة رائدة في مجال علاج الأورام الدقيقة، وتأسست عام 2012 ونمت بهدف مساعدة المرضى للتغلب على مرض السرطان، وهي تعمل على إحداث تحول في رعاية المرضى من خلال توفير رؤى حول الأسباب التي تسبب المرض من خلال اختبارات الدم والأنسجة المتقدمة وتحليلات الذكاء الاصطناعي، كما تساعد الاختبارات الوقائية على تحسين النتائج في جميع مراحل الرعاية بما في ذلك الفحص للكشف المبكر مرض السرطان ومساعدة الأطباء على اختيار أفضل علاج للمرضى المصابين بالسرطان في مراحله المتقدمة. الدكتور حلمي الطوخي بعد حصوله على درجات الدكتوراه والماجستير والبكالوريوس في الهندسة الكهربائية من جامعة ستانفورد، انضم إلى مركز ستانفورد لتكنولوجيا الجينوم SGTC كزميل ما بعد الدكتوراه في عام 2006 للعمل على تقنيات تسلسل الحمض النووي منخفضة التكلفة أثناء دراسته للدكتوراه في SGTC، وقام بتطوير أول منصة لتسلسل أشباه الموصلات وأول خوارزمية استدعاء أساسي لتسلسل الجيل الثاني. والحديث أكثر عن هذا الموضوع اللي قد يكون معقد، وهلا رح أجرب أبسطه مشاهدينا قدر المستطاع. التقنية الخاصة بعلاج مرض السرطان. نتشرف طبعا باستضافة الدكتور حلمي الطوخي، المؤسس المشارك ورئيس مجلس الإدارة والرئيس التنفيذي المشارك لشركة Guardant Health. أهلا وسهلا فيك. Good morning.
Good morning.
We're so happy to have you here with us, Dr. Touchi. This is an amazing, innovation. It's very easy now, or it's getting easier now to know whether one has cancer or not through these really, up-to-date ways of screening. Let's start with the beginning for people to know what exactly is Guardant Health doing. What exactly is the solution, the new solutions that are provided to be able to screen whether one has cancer or not?
Yeah, no, that's very exciting, the technology we've developed. Basically, if you think about how it works, cancer is growing rapidly. That's a sort of unifying concept in terms of the disease. And when those cells grow, they're also dying rapidly. And what makes cancer unique is the different DNA or the different genome that the cancer has. And so when those cells die, they shed their DNA into the blood. And so we developed a technology that can take a tube of blood, can find those molecules of DNA, and then use machine learning to essentially sort them out and detect the cancer. And so the technology now is used in three main areas. We started with existing cancer patients, so patients that have been diagnosed with cancer. Yes. And rather than doing a surgical biopsy on those patients, we can use a simple blood test to match them to the best possible treatments so that they can do much better. What's exciting is as we've improved the technology and made it more sensitive, we can now use it for early detection of cancer. And so the first test that we're rolling out is a test called SHIELD that can essentially replace a colonoscopy to detect colon cancer.
That's amazing. So for the time being, it only covers colon cancer.
So we have three classes of tests. The first class for existing cancer patients covers every cancer type: breast cancer, lung cancer, prostate cancer, colon cancer, hundreds of different cancer types. And that test is now a standard of care. In the United States, for example, something like 30 to 40% of all US cancer patients are taking our test today. We're actually one of the largest cancer testing companies in the United States. And what brings me here to the region, to Jordan, is really this partnership we're doing with Hikma, and the idea of bringing this technology to the region and making sure that every cancer patient essentially gets the best possible treatment.
That's fantastic. Can you tell us more about, the talks that have been going with Hikma and, the Cancer Center, or whatever, the institutes that you've visited in Jordan? How is it going?
Yeah, we just visited King Hussein Cancer Center, which is very impressive. It really is a shining beacon of the Middle East in terms of how advanced the care is. And I was just very impressed by the history in Jordan in terms of really being first in the region in terms of some important medical procedures, like the first heart transplant in the Arab world happened here. And it's been really exciting to see that. And so their talks have been about really figuring out, what is the best way to partner with the amazing medical researchers here and the clinicians so that we can address the unmet need in the region. And certainly early detection is a big area. compliance with existing screening. I mean, you know how difficult it is to convince, people to do a colonoscopy. It's an invasive procedure. It takes 2 days. And so if you can replace that with a blood test.
I was just complaining to you about my husband. It's almost impossible.
Exactly. And if you can replace it with a blood test, you can change the paradigm completely. I'll give you some statistics. In the United States, there's about 50,000 people that die from colon cancer every single year. 76% of those deaths come from those that aren't screened. So screening works. Screening really reduces the number of deaths. It's just people don't want to do it. They don't want to do a colonoscopy or a stool test. And so if you can get the same information through blood, it's going to change everything.
So this is basically part of early detection. It's just like, breast cancer. The earlier it is, the easier it is to, to get the treatment, and you have higher rates of actually surviving and being cured. Can you tell us more about how you're planning to, sort of spread this amazing innovation around MENA region as well?
Yeah, so we're right now working with the different health authorities, with our partnership with Hikma, to really understand how we can essentially bring these tests into the existing medical infrastructure. Not only have them administered on patients, but thinking about public reimbursement, private reimbursement, so that these tests aren't a financial burden on the average patient. What we found is that these tests actually save money in terms of overall cost of health. In lung cancer, for instance, I know the US numbers. In the US, a lung cancer biopsy costs about $14,000 per patient because of the complication rate. 20% of patients have a complication. 1% actually die from the biopsy. And so if you can replace that with a simple blood test, you change everything. We just implemented this technology in the United Kingdom. We partnered with the National Health Service over there. And what we found was the average lung cancer patient has a life expectancy of only 11 months. And so lung cancer is a terrible disease.
Sure.
In the UK, people were waiting 120 days or 4 months to get on treatment. So they're waiting half their life to get a treatment.
Which doesn't make sense.
We did a pilot with them, and we found that essentially within 9 days, we were able to get people on treatment with our technology. So that's the promise of what we could do here in the region, is really
wonderful.
Leapfrog sort of the existing infrastructure so that it is a shining beacon for the rest of the world. So it's the most advanced healthcare system in the world.
That's amazing. Doctor, I was just thinking, how is this amazing evolution and innovation taken by everyone? Usually when it comes to anything new that has to do with cancer, it's usually rejected or it's kind of, parked on the side. Yeah. How did it go with you guys? Yeah,
initially there was always disbelief because people, even medical researchers were amazed. There's like, how could you get that information through blood? Normally you have to do surgery, normally you have to do a scan. And so it took a lot of convincing. We now have almost 500 publications on the technology. We have FDA approval on the first version. We have a FDA approval pending on the early detection test. And so we've invested about $2 to $3 billion in the technology. We've obviously spent a decade in terms of R&D, research and development, and publications and clinical studies. So it has taken a lot of work to make this dream a reality.
It's almost hard to believe nowadays. It's amazing to know that this is actually going to be part of, Jordan's medical, scene. Just wondering, I was listening to an interview with you this morning, and I heard you talk about NASDAQ. Can you tell us more about that?
Yeah, so we're a listed company. We went public on the NASDAQ about 5 years ago. And it's been wonderful in terms of it's the financial performance has been very good of the company. But I find myself, one of the values we have in the company is putting patients first. And so financial metrics are obviously important, but the most important metric for us is how many patients' lives we're saving and changing. And that's what's exciting about going from late stage to early stage, is that potentially we can save millions of people from the tragedy of cancer.
Yeah, that's true. Inshallah, we're hoping that this is actually, that this will be applied in Jordan very soon. Before wrapping up, can you just tell us about your vision for the coming 5 to 10 years?
Yeah, so I really do look at these blood tests as really a new paradigm. A lot of people are comparing them to the old standard of medicine. But what these blood tests allow us to do is we're unlocking an unprecedented amount of data from a tube of blood, literally terabytes and petabytes of data from a single blood test. We see what's happening with ChatGPT and AI and so on. The same thing is going to happen with these blood tests. Imagine a blood test that is tracking almost every single biomarker in your body every time you go to a physical. And imagine, using that AI to understand what's changing. And so this paradigm is starting with cancer, but eventually we'll be able to detect almost every disease before it's too late. And this is an exciting beginning of a really bright future that we all have.
It's amazing. For those who are fearing AI, here's one big advantage. Thank you so much, Doctor, for your time. It's lovely to have you here. Wishing you guys all the best and hoping to see this actually happening up and running in Jordan.
Thank you
for
so
your
much.
time.
Thank you.